collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Haralambous.
Coming up on this week's programme, we hear that childhood cancer rates in Cyprus are among the highest in the world.
The frequency, the incidence of our cases in Cyprus are among the highest in the world, which is alarming and shows that we have to do a lot of work in Cyprus to better understand. Let me tell you that only Italy and Belgium have cancer rates in this age group that are higher than in Cyprus.
And as the world marked Antimicrobial Resistance Day, we hear about the overuse and misuse of antibiotics in Cyprus.
There is an antibiotic overuse, and we consider statistics, and actually we are rated among the first in Europe in terms of antibiotic overuse.
A recently published paper in the peer-reviewed journal Cancer Epidemiology is the work of my next guest on this week's programme. He is Professor Loizos Louizou from the University of Nicosia Medical School, who for 32 years was director of the Paediatric Oncology Department at the Makarios Hospital. He joins us now to explain the importance of this new paper. So Louizos, first of all, what were you looking at and how did you go about doing the research for this paper?
Actually, this family of diseases was never examined before thoroughly in Cyprus. Therefore, we studied the epidemiology of the cancer in the 0-19 years old. We studied also the temporal trends, and we compared it with the worldwide situation. And our purpose was to better understand what is happening in our country, because by understanding better this, we could perhaps make better prevention and also make better control of cancer activities, better attribute our resources and efforts. Now, this was our vision, and our strategy was to, first of all, create this Pediatric Oncology Registry of Cyprus, in which we registered all the patients of our population. It's a population-based registry with all the data and all the children with solid tumors and diagnosis, with the children with solid tumors and hematologic malignancies. And therefore, we had a complete population-based registry.
Now, I think I'm right in saying that cancer in children and adolescents, which is abbreviated in the literature to CAC, well, yes, it's very high in Cyprus, particularly when we talk about leukemia. So can you just talk a little bit about what you found with regard to leukemia and other hematological cancers and the difference between that and other types of childhood cancers which tend, I think, to be solid tumours?
Absolutely, this is a very good question, and let me start in the beginning by saying that childhood and adolescent cancer is different than in adults. It is not a single disease. There are 12 broad categories with more than 100 subtypes, and actually what we found in Cyprus is that the most frequent family or the most frequent group is the group of leukemias, which represents the biggest, the biggest group. It represents approximately 26% of the whole. It's followed by lymphomas that represent 21% of the whole, and then by brain tumors, 11%. And actually at that position, we have the thyroid tumors, what we call the specified epithelial neoplasms category, in which the thyroid tumors are included. This family is the third position, and then are the brain tumors with 11%. Now, if we take the four main groups, that means leukemias, lymphomas, thyroid cancer, and brain tumors, these four groups together, they represent 73% of the cases that we have in Cyprus. This is an important finding, but another important finding that we have been able to demonstrate is that throughout the 20-year period for which we have complete population-based data, the frequency, the incidence of our cases in Cyprus are among the highest in the world, which is alarming and shows that we have to do a lot of work in Cyprus to better understand. Let me tell you that only Italy and Belgium have cancer rates in this age group that are higher than in Cyprus. Also, there is a difference in the distribution of the different frequent types. For example, as I mentioned before, leukemias are the most frequent, but lymphomas and thyroid cancer are more frequent than brain tumors, which is different than other countries. Also, another much more important difference that we have been able to demonstrate that exists in Cyprus is that we have one of the highest, if not the highest, incidence rate globally for the thyroid cancer in the adolescents. Thyroid cancer in Cyprus affects the 15-19-year-olds in the age group that we are interested, that means in the 0-19. So the 15-19-year-olds, and mostly in girls, the trends are the most high, perhaps the second highest in the world.
Can I interrupt you there, Louisos, and ask you to talk a little bit about what effect a person's location may have on this? Because geographical differences in the incidence rates suggest that there may either be genetic or environmental exposures that affect the risk in our children. Can you elaborate on that?
Absolutely. Excellent question, Rosie. You are absolutely right. Actually, we are now developing a tool that will automatically and dynamically and continuously give us information and association between our data. That means the number of cases per district, per town, per community village, for example, per postal code and per street. And this tool that we are developing now online, which of course is protected, and we have access to it only us enabled to make our studies. This tool automatically, first of all, shows on the map, it visualizes the cases and automatically makes calculations of incidence, that means density or frequency of cases, so we will be able to better answer this question. That means the relation between the incidence, that means the number of cases per unit of time, per geographic unit, I mean district, town, postal code, road.
So you can be that specific in terms of which end of the road was more affected. Is this to do with things that we've heard about in the past, like high voltage wires from the electricity authority, or indeed some of the factories that have been in the news over the years for putting very dirty effluent into nearby rivers? How do you do all that?
Okay, excellent question. That's exactly our purpose, is to be able, because we have a small country, we have certain strengths here, certain important points. Because we are a small country, we can follow up very well our patients, we can very well study our geographic distribution. So this is a strength in comparison with bigger countries where the situation is more complicated. So we can do these studies. So our purpose is to see if we have abnormal concentrations according to the population variables. The Statistical Service of the Republic of Cyprus gives us at least 110 variables of the population from, for example, socioeconomic level, economic level, presence of various other factors in the surrounding, and of course we can always add studies that we do in these variables. For example, concentration of arsenic, which is an ischemogenic agent, or radon, or other factors, and on the limit we can go up to the distribution of electromagnetic fields, etc. However, let me tell you that we are not ready to answer these questions now, because as you understand, these are long-term studies, and it's only since a couple of years that we started doing this effort. And already we published 2 papers like the one you mentioned before, which showed what I mentioned before about the frequencies of other cancers in Cyprus, thyroid cancer, etc. And now our purpose is exactly to go to this depth, but of course for the moment we are limited to the data set of the 0-19-year-old. In the future maybe we will expand to more cancers, and of course we will create the basis so other groups can also work in the same field, and perhaps the future generations. We're creating the infrastructure which was missing in Cyprus, and also in many developed countries, not only in Cyprus, because it's a new field, a relatively new field. So we can answer these questions, and it's not an easy task, it's a very difficult task. Now, the second part of my answer is to specifically answer your question if we have any data till now. Let me tell you that in the year 2000, I did by myself, but without the strength of the team that we have now, which is an international team of experts with the participation of top two experts from the United Kingdom and in charge of this field for the epidemiology of childhood cancer, also from Germany and from France. The 8 persons who are co-authors in this work are in this group, so the work we are doing now is much more robust, much more solid. But let me tell you that preliminary data that we have from previous measurements or previous calculations I did by myself, but were not published because I was not sure that they were so robust, and we have to review all this, showed no significant difference in the geographic distribution, which is understandable. But on the other hand side, I am hopeful that in the next 1, 2, 3 years, I will be able to announce you much more robust and correct data answering these critical questions.
Right, now let me come to one of the things that I think was reported in your paper, and it said childhood and adolescent cancer is rare. It represents from less than 0.5% reported in Europe and North America to 2% in developing countries of all cancer cases, but there are large variations in the reported incidence. Now, even accounting for those large variations, that's a huge difference between 2% in developing countries and 0.5% in Europe and North America. Can you attribute that difference to something, for example, like nutrition?
No. These large variations are attributed for the moment to the lack of sufficient data in many countries. Actually, there is a major, among the other major issues that we are confronting in managing childhood cancer, and parentheses I would like to add, I always mean, when I say childhood cancer, I mean the cancer in the 0-19 age group. This is the definition. So in this field, we have many challenges. One of the challenges is to know exactly what happens in each country. Unfortunately, there is a serious lack of incidence and trends data, and this lack of registries that we have mostly in the less rich countries hamper the cancer control activities. Also, certainly hampers our understanding of what's happening. So these reported incidences have to be taken very carefully. That's one more of the strengths that we have in Cyprus, because we have very good data, and the quality criteria of our pediatric oncology registry of Cyprus are very good. I'm not going to go into detail, but we have proven that the quality criteria of our childhood cancer registry are excellent, among the best in the world, comparable to those of developed countries, which means that the studies that we will be doing based on this registry will be valid. So in order to see whether nutrition plays a role, and you very rightly pointed to this factor, Rosie, and thank you very much, because after this study we did, we concentrated our attention into 4 hypotheses that resulted from these descriptive epidemiologic studies. The first the best hypothesis that we want to explore is obesity and overweight in children and mothers also. And this certainly has a direct link to nutrition.
And we have a terribly high rate of obesity in children in Cyprus, but I also wanted to ask you about prenatal care and things like folic acid. I mean, you don't get that, I'm sure, if you're in a developing country. So does that account for this high 2% in those countries?
That's it. I cannot answer by yes or no, because nobody really knows the answer now, because to my knowledge, no such study, I don't know such a study. Perhaps it exists, but I don't know it. And I reviewed a lot of this literature during the last years, but I'm not aware of any study that studied, let's say, the management of folic acid in the women who want to become pregnant or in the women who are pregnant, and see what impact this had, and also to compare it or to take into consideration the quality of the registries.
But it is, I think, documented that a lot of cancers, you will tell me which ones, but anyway, for the fetal health regardless, and particularly for other disabilities or problems with the fetus, folic acid is a must. And if you can't get it from your diet, then certainly in developed countries it tends to be taken as a supplement.
You're absolutely right. Folic acid, it's important to be given to women that are pregnant and also before pregnancy, I would say, because it has been proven that folic acid is important for the prevention of anomalies of the central nervous system, of the brain, of the spine. There is a condition called spina bifida that is a debilitating condition. It has various degrees of severity, but folic acid can prevent that, also in omphalocele. And there are also reports that women who have been sufficiently taking folic acid before they get pregnant, and also they take it during pregnancy, their children have less chances to present with leukemia. So you are absolutely right, folic acid is important, and I would suggest that women who want to get pregnant or women who are pregnant, in any case in Cyprus it's common practice that the gynecologist prescribes folic acid to women who are pregnant, but I would go beyond that and say that women who want, young women or not so young women who can become pregnant should have a nutrition rich in folic acid, and perhaps it would be interesting here to say some nutrition, because it's very important to have a nutrition rich in folic acid, because folic acid, which is also known as vitamin B9, so there are many excellent nutrients that we can have in our everyday nutrition. For example, green leafy, if I said it correctly, vegetables, broccoli, peas, asparagus, bananas, oranges, whole cereals, legumes, dry nuts. All these are rich in B9. And so these are important, and women can of course take folic acid as a supplement. It's one of the rare cases that we recommend supplement, and also their gynecologists will advise them in case that they want to become pregnant or they are already pregnant.
Well, it's a good idea, I guess, for people to adjust their diet anyway if they're thinking of becoming pregnant or they are pregnant. Yes. We have to wrap this up, Loizos. Let me just ask you whether the result of your study has improved ideas for every country to follow your lead and put in place their own paediatric oncology registry, because then there would be a global comparison data that people could see what's the best practice and how to move forward.
Absolutely. This trend is very important, and what we did actually is we did exactly what is recommended by the highest international bodies for the fight against cancer. Either they are from the World Health Organization of the European Union. So one of the main guidelines, or if you want, one of the priorities, and if you want another emission, we can talk about our 10 priorities in childhood cancer. The second priority is exactly this, to understand the etiology in order to make a better prevention. And that means make registries to understand the epidemiology, to understand what happens in each country. So many countries are doing this, and definitely I think we did a good work here. But of course other countries are doing the same things. But what is important is a global effort. We work all in the same direction, and I hope that many other countries, especially in the less rich countries, go in the same direction, because it's not an easy task to create a population-based registry and be able to draw significant or meaningful conclusions.
Indeed. It's been a pleasure talking to you, Loizos. That's Professor Loizos Loizou from the University of Nicosia Medical School. Also, for 32 years, the Director of the Paediatric Oncology Department at the Makarios Hospital, and one of the authors of that Cyprus Paediatric Oncology Registry, which was reported in the well-known peer-reviewed journal Cancer Epidemiology. Loizos, many thanks.
Thank you very much, Rosie, for inviting me to speak about this very important subject.
Keep up to date with events in Cyprus and around the world with the Cyprus News Digest.
In collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Haralambous.
the biggest achievement of Crime Stoppers has been the ability of the public to be able to give information about crime anonymously.
There's no way I could have kept prostituting without the drugs. There's no way I could have had my body used like a public toilet, because that's actually what prostitution is.
And then the fourth series I started 3 days after I'd won the Oscar, so the whole of the Moloch of the Glen experience was all interplatted with the Gosford Park Oscar experience.
I was working with Ronnie James Dio, and David was going to reform Whitesnake in 2003.
Cyprus was chosen because Cyprus is a stable, peaceful and secure place.
We have to really look closely. What are we doing with children? What are we doing with adolescents? And what are we doing with adults that can help them move into a more literate situation?
The ones that I'm proudest of are the ones that were true discoveries, where we found something we didn't know existed.
Our health minister has been in Oman this week. That's against the backdrop of World Antimicrobial Resistance Awareness Week, because it seems that in Cyprus we have quite a high incidence of antimicrobial resistance. I've asked George Samoutis, who's a GP in our national health system, to join me and explain what that's all about. George, I think before, when I've spoken to doctors here about antimicrobial resistance, I was under the impression that we were actually pretty good in Cyprus about knowing how we should take antibiotics, but do we take too many of them?
Yes, hi Rosie, thank you for inviting me to comment. In Cyprus, unfortunately, there is an antibiotic overuse, and we consider statistics, and actually we are rated among the first in Europe in terms of antibiotic overuse. So I think after the NHS has been implemented in June 2019, things are getting better in terms of antibiotics overuse, but still there's a lot of room for improvement in terms of educating the patient, especially about when they need to get an antibiotic.
There was, I think, in the past a tendency here for people to think an antibiotic was the answer to everything, and I think we all know that it was an amazing discovery that's had a huge impact on the way certain illnesses can be treated. But in Cyprus, I think we know that it doesn't do anything at all for viruses, so why is there still so much misuse? At least that's what the Cyprus Society of Clinical Microbiology and Infections says.
Yeah, I think it's about the culture that was cultivated years ago, and now hopefully with the new NHS and people having their own GP now, and people have access to also to physicians rather than going to the pharmacy and asking for antibiotics, things are changing. So basically what we need to do is patient education, that the vast majority of upper respiratory tract infections of a common cold, they don't need an antibiotic so you can get over them. So basically we need to remember that antibiotics, they need to be taken cautiously. So if somebody is overusing them, what's going on? When really needs antibiotics, then you will not be able to have a success with that because he or she has developed already resistance to that antibiotic. So I think it's about educating the population and the patients about the risk and about when they should seek help and get an antibiotic.
Do you think the average patient in Cyprus understands that, and that there is a documented increase in mortality and as well as the severity of your illness and how long it lasts if you do have AMR?
I think there's a lot of, as I said, a lot of room for improvement. The average patient in Cyprus, unfortunately, they are not well educated on this issue. And this is a role of the journalists like you, and thankfully you are doing the right thing now, and we very much appreciate what you are doing, that we inform the patients and the population of Cyprus that antibiotics are a fantastic, a super drug, but we'll have to use it very cautiously. And there's a number of practices that in everyday practice I discuss with my patients. For example, we have, when a patient is asking for insisting for getting an antibiotic, what I'm usually doing, the practice called delayed prescription. So I tell them, okay, you're insisting that you need antibiotic, I think you should wait. So I give them 48 hours and I give them a delayed prescription. I said to them, okay, let's wait 48 hours. And if things are not subsidized or not getting better, then we may get the antibiotics. So I think it's a good practice, a delayed script, and the vast majority of those patients, they will, in 2 days, 48 hours, they will get over the main symptoms and they will not take the antibiotics. So that's a number of practices as well that the physicians they need to discuss with the patient, and also has to do with the communication with the patient. I think we need to communicate it better to our patients about when and when it's not needed to take antibiotics, and this has to do with the so-called shared decision-making process, that we need to involve our patients in the decision process and discuss pros and cons of each intervention.
How far is the overuse of antibiotics in our dairy industry particularly contributing to this? Because I guess that in our milk and cheese we are actually consuming residues of antibiotics on a pretty well daily basis.
Oh, that's a very good question. Yeah, unfortunately, we know that it's not just the consumption of antibiotics, the overuse is not only done in humans, and unfortunately we have done the same wrong things with the animals. So there's an overuse of antibiotics in animals. So that's why it's very important that we do our best so in terms of we don't consume antibiotics when it's not needed. And also at the same time, we should, let's say, cultivate the culture of not overusing antibiotics also with our animals and our pets and in terms also, as you said very correctly, in terms of cows and sheep. So because we know that they go into the milk or into the cheese, and then we get also antibiotics through other sources.
Yeah, well, we are ingesting them. I think they're used prophylactically in our animals in the farms in Cyprus. It's also very worrying, George, that they reckon, I believe, from the EU, the latest figures, that the number of deaths that result from infections that don't respond because of antimicrobial resistance, it's going to be actually over 10 million deaths by 2050 per year, and that's even more than the number of deaths from cancer. Are those scary figures something that should be out there for people to stop and take stock and think about?
This is a very important question again, Rosie. I think that probably the next public health threat is antibiotic resistance. So after COVID, I think the next big thing in terms of public health is antibiotic resistance. So we're going to enter in an era that will not be able to, firstly, to be able to have antibiotics that or bacteria that are sensitive to antibiotics because of the overuse with it and the resistance that they develop. So somebody, let's say, gets a pneumonia and the antibodies not be working, then you die. So I think we should be very, very cautious, and something the governments and the public health policymakers may need to take into serious consideration, that we implement strategies so we restrict the use of antibiotics when it's absolutely needed. And not only that, we need also to implement a strategy that we use the right antibiotics. And then thirdly, we need to understand the importance of the microbiome. It's very important that we understand that the vast majority of our immune system is located in our intestines. So our microbiome, which is our intestinal flora, is extremely important for our immune system. So if we destroy that microbiome, the intestinal flora, with the overuse of antibiotics directly or indirectly through our food, then we run into the risk of having an immunosuppressive, getting problems with our immune system.
And of course, antibiotics do destroy that good bacteria in the gut, and that's why I think everybody is recommended to take yogurt when they're taking antibiotics.
Exactly, or yogurt or probiotics that recover our intestinal flora from the use of antibiotics.
So the bottom line is, don't take them unless your doctor pretty well insists that you should, because very often your own body will get over what you think requires antibiotics. George Samudis, thanks for joining me.
Thank you.
Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.